been absent. Good afternoon, everybody. We're just about to get started with the exec team Q&A. We're expecting Julie Attfield to join us, but I can't see her on the chat just yet. But if she does join us, there's a question for her. And as always, John, we'll kick off with you. And if anybody's got any questions, please put them in the chat. That would be really useful. Over to you, John.
Thanks, Yolanda. And just to say, we've also got Anne-Maria, my Director of Nursing and Quality, on the call too. She's not mine, as you all know, but it's just a little joke we've got going on between us. You're all very, very welcome. I just had a bout of sneezing, so apologies if I start to cough and splutter. I think it's just a virus. By way of introduction, so as ever, to kick off by warm welcome, looking forward to a good conversation. Feel free to put some comments and questions in the chat. We haven't got a load of questions sent in through the week this week yet. There's Julie. So get asking. Just a few headlines before I go back to you, Yolanda. We're in an uncertain time, aren't we? There was all the sort of euphoria of coming out of lockdown, being able to go to people's houses, etc. And then it's been sort of underplayed because of concerns around the Indian variant, and now the lack of clarity about what's allowed and what isn't allowed. And I'm sure that's playing on people's minds and their personal lives, and it's additional things to think about, consider how we continue to stay safe. Is it really over? What's next? Shall I go on holiday? Where can I go? So we do appreciate that it's an uncertain period. We just heard, I've not told anybody, I've just got a message this morning that that Nottingham City has been identified for increased vigilance and surge testing for the Indian variant. So watch out for that. When we've got a bit more formed information, we'll put it in the communication piece about exactly what that means. However, from a positive perspective, the numbers coming out are still all going in the right direction in terms of numbers of new cases nationally and both locally here, number of admissions and deaths reducing dramatically, and so far there hasn't been any upturn in that. And although there's a lot of media coverage about the variant, the actual numbers are still relatively small, and hopefully the mitigations are in place will contain it. What does that mean for us? Much the same. The message will be the same. I'm sure we'll hear Anne-Maria if we get to talking about what does it mean in terms of social distancing and IPC and masks, etc. We're still saying the same message. Things haven't yet changed. We're still at 0 outbreaks, which is really good news, and that's been for quite some time now. I touch wood every time I say that, because we do appreciate that the massive challenge that puts into all our staff to maintain those healthy, virus-free environments. So thank you for your continued vigilance. There's a couple of specific things I just wanted to say. The first is, I suppose on a somber note, really, we've had a couple of inpatient deaths in the last few weeks across the organisation. Probably one of the most challenging issues that individuals and teams and team leaders, managers particularly, come across in their work. And I just wanted to take a bit of time to say and thank you for what you're doing, and appreciate the real difficult conversations and issues that arise out of that, not just the massive external scrutiny that we have to manage organisationally, but the much more sort of intimate and personal conversations we're having to have you're having to have with families and carers. It's a really difficult time. And we do have a lot of support around informally. If you or colleagues that are struggling, then do say, and could do appreciate it's really tough. But just to say thank you for managing those very sad, unfortunately very rare occurrences. The second thing I wanted to just mention, we know there's a lot of issue with some of our IT and digital infrastructure as a result of a recent update. So again, wanted to thank you for your patience, but I particularly wanted to acknowledge the work of the IT technicians and the hours they're putting in to try and help people reconnect and sort out whatever the glitches are in the system. We do know that from a more strategic perspective, there's quite a significant requirement for us to invest in our digital infrastructure, and it's certainly one of the priorities that we're considering, how we best do that and get the best value for the sorts of things that we need to put in to improve your user experience. So I just wanted to flag that as well. So by way of introductory comments, Yolanda, that's probably enough for me to kick us off. I'll hand back to you, and then we can start to pick up some questions. Thank you.
Okay. I'm going to start off with Anne-Maria taking a couple of questions, if that's okay, regarding vaccinations, Anne-Maria. So the first question is, why haven't staff who've had a vaccine been told they can stop wearing masks and visors? Does this mean that the vaccine isn't preventing transmission?
Okay, so thank you very much for the question. I'm not sure if people are aware, and certainly it's been on the news a lot around the fact that we do have the Indian variant now that's surging through the country in various places. We've got 4 big hotspots across the country. We are still adhering to the Public Health England's national guidance and advice on personal protective equipment, PPE, which includes our masks. So my big thing around this is that even if you've had 1 or 2 jabs for the COVID vaccine, and even if you are doing your lateral flow testing and recording that, the need to use masks is still important because you can still spread it even if you've had your jabs. So you're still able to spread the virus, so you can still have it and spread it, even if you've had your jabs. It just means that if you do get it, you're not going to be as poorly, nowhere near as poorly. And you might not even know you've got it. You're just spreading it and transmitting it around to other vulnerable people outside that have not had the opportunity to have their jabs yet. So as most of you are aware, we're at 38 years of age now, so 38 years and above, including vulnerable, care homes and all healthcare workers. And that's really important. So that means that there's a whole cohort of people that still haven't had their jabs, and it's important for them to have that opportunity. And it means that it relies upon people like us to still adhere to the guidance around PPE, masks, social distancing, and hand washing, and keeping sort of like as safe as we possibly can. We've also got a responsibility to our patients. Our patients can't move away. They're vulnerable, they still need care. And so therefore, why would we not want to wear masks for our vulnerable patients as well? So I feel really strongly about this. I need people to know that we are following National Public Health England's guidance on wearing masks, even if you've had 1 or 2 jabs for the COVID vaccine. This is very important. I hope I've answered that question. It's a bit of a passion of mine, so I might have gone a little bit off track, Yolanda.
Not at all, Anne-Marie, and I've just put something in the chat as well. I
Yeah, fresh air.
The government have also added fresh air to the hands-based message.
So can I just say for us, that's ventilation. And what we've said now from infection prevention and control perspective, through the winter, whilst it was very, very cold, we were advising 10 minutes fresh air per hour. What we're now saying is it's getting warmer. If you can just leave a window open, if it's possible, if you can leave a window open all the time, that would be great. It really, really disperses the virus. And we know that the viral load is reduced greatly if we use ventilation.
Thank you, Anne-Maria. I think in giving a so comprehensive response to question 1, I think you've actually covered question 2, which was about if the vaccine doesn't prevent transmission, what's the point of getting the vaccine, given that the vast majority of people might develop immunity naturally. So I think you've covered that one off quite nicely. Your comprehensive answer, Anne-Maria.
Yeah, I think I have, but I do want to say it does rely heavily upon the population getting vaccinated. It will not work if only 60–70% of the population get vaccinated. So a lot of people are saying, oh, well, it won't matter, we'll just have herd immunity. It does still rely heavily upon the majority of the population having the vaccination. And I just wanted to say, having the vaccine doesn't prevent transmission, but what it does do is prevent you being as poorly as you could be, but that poor vulnerable person who you give it to might not be as lucky.
Thank you, Anne-Maria. Moving back to you, John, for the next question, if that's okay. Somebody's put in a question asking about the county-wide service being set up for health and wellbeing for staff. Is this something for all organisations in the system or just some of the organisations? And is it available yet? And how do people access? Tracy Yolanda was intending to be on the call to take that question, John, but unfortunately she's not going to be on the call. So if you're happy to take that question on Tracy's behalf, that would be great, please.
Yeah, thanks, Yolanda. So there's a couple of things to say about health and wellbeing, and just to people might be a bit confused about what the offer is. So we've got our own organisational offer, which is, you know, one of those things that's come out of the you said we did work over the last couple of years to develop our own health and wellbeing staff support function, and Tracy Orlandi heads that up, and we've got a sort of an increasing suite of services within that. This is related but different. So we've been working with the CCG to provide a staff support service for all health and social care staff within the county, to provide a rapid access mental health triage signposting sort of service. And this is something that's been funded regionally. We've received money that is specifically targeted for this, but to emphasise that it's for all health and social care staff, not just our organisation. So in essence, ICS, social service staff too, but with a similar sort of remit around mental health and wellbeing as a consequence of the pandemic. So it's quite targeted. It's been launched sort of softly, if you like. So we're already getting people in from our own organisation, but there'll be a full launch towards the end of this month, and we'll be putting details and content within Connect pages. There'll be comms on it as well, so that people are more sighted on exactly what it is and how you can access it. And it's a very jolly, very good thing to be doing. Thank you.
Thank you, John, for that. Julie, just moving over to you. This is the final question that we've got for today. We've had a question asking whether we're having difficulties recruiting staff to work for the Trust. And if that's the case, what are we doing about it? And also a bit more detail about what's happening with recruiting staff to the new Sherwood Oaks facility. And I know that you're the expert on all things to do with that. So if I could move to you for that question, that would be really useful, Julie. Over to you.
Yeah, I mean, I can primarily comment in the context of local mental health services. So last year, for every advert that we ran, we filled the post 50% of the time. So if you put that into context, yes, filling vacancies is a challenge. There are national shortages in some professions, and there are challenges to recruiting sufficient numbers in some posts. But I think we have to put that in context. So in the last year, the mental health division's clinical staff increased by over 100. And in the coming year, we need to increase our staff, hopefully by 250 actually. So we put it in the context of our turnover, but also growth. And I think the fact that we've managed last year to keep up with the turnover, but actually increase the workforce at the same time, shows that we are making some headway. Anecdotally, I feel that we're not becoming in a increasingly worse position in this. I think actually the narrative that's coming out is that it's not always easy to fill posts, but we are getting them filled. So there's some, I don't think we struggle in the same way as we did probably 2 to 3 years ago, because I think there is a bit more supply coming around, and often we're hearing of people being attracted into the trust from outside of Nottinghamshire. So I think that's got to be a real positive. So yes, it's a challenge. It's going to be a challenge. And we're in the same position as lots of other organisations chasing after a finite resource. But I think there's some sort of positives around. We have managed to achieve that growth. I have to say it's been hard work, and that's rather, when people say, well, what are you doing about recruiting staff? We are working extremely hard through all sorts of ways of reaching potential future colleagues. So we're doing a lot of fast-paced live recruitment. We're doing a lot of open days, virtually or otherwise. And we've done a lot of streamlining to make the recruitment process better. I think that's probably some of the things that have actually helped pay off, really. So we're not in the position of offering somebody a job in January and never speaking to them again till March. I think those days have gone. I think we are on it in terms of recruitment. The background behind me says something. We've got a social media campaign going. We've got our own micro recruitment site. And there's a lot of social media presence now, thanks to Yolanda and colleagues around developing all the marketing, the printed advertising. I don't know if you see this. Oh no, I don't think you can. Well, on my phone, I don't know. No, you can't see it. There's a picture of a petrol pump nozzle, and it says recruiting now at Notts Healthcare, blah, blah, blah. And it shows you how to get all of the vacancy details. So it looks a bit like that behind me. What else is there? There's going to be advertising on our own vehicles, on the back of buses, and we've got signs up on roundabouts and all sorts of things. So some of that's focused on Sherwood Oaks, but some of it's more broadly and more broadly applies. So there is an awful lot going on, and there's a virtual recruitment day, for example, on the 10th of June for our CAMS services. So I can confidently say we're being very active. And on the Sherwood Oaks front, I keep a close eye on the numbers of registered nurses that we need every couple of weeks, really. We're looking for 16 more registered nurses for Sherwood Oaks, ideally. But I think there's a lot of confidence actually that that we're going to get to where we need to be. And if colleagues are confident, then I'm inclined to feel that way as well. So that's a bit of a snapshot of where we've got to.
Thank you, Julie. Before handing over to you, John, to talk about the Trustwide picture, Tina Hancock has put a comment in which has already had sort of 3 or 4 likes in the comment section, but she can confirm the recruitment process is incredibly quick at the moment. She says that it's taken her 2 weeks to get a new recruit ready to start, which is amazing. So thank you, Tina, for those very positive comments about our recruitment team. Much appreciated. John, I'll hand over to you now just for you to talk about the Trustwide picture about recruitment, if that's all right.
Thanks. Yeah, we'll take over the national recruitment in a couple of months' time, but for now we'll sort our trust out. And thanks for that comment, Tina. It was a bit of a stand-in joke, although not a very funny one, about our ability to recruit people swiftly and smoothly a couple of years back. And I got a lot of commentary through my inbox and elsewhere about how long it took from identifying a vacancy, advertising, going through all the bureaucracy, and actually getting people in post was taking months and months. And given the challenges that you're all facing day in, day out, it was way off where we need to be. So I'm really heartened to get some feedback like that. And Julie's sort of summarised pretty well what I was going to say. The other thing I would add, that whilst obviously all of that is exactly the sort of thing that we need to be doing, the other aspect that I come at this from is that the other thing that's on at the back of Julie's background is the trust values making a difference, and the ability to make organisations a great place to work, where you create really good working environments, where we really live those values, where there are good employment relations, conversations, the working with staff side, with other groups works well, using those values. Not to say there won't be issue, but uses those values that we live. You start to develop a bit of a movement, really, or not healthcare, that's going places. The people that live in the East Midlands have got a huge choice of where they work in the public sector, and particularly in the NHS. There are some very big and some very good organisations around, and we're fishing from a pretty similar pool, and people have got choices. So we need to keep pushing that Notts is going to be the best place to be, and this is where we want good people to come, from whatever professional group, and to bring their expertise and to bring their values to our workplace. So that's just to emphasise the other aspect of this, as well as the more sort of direct, formal recruitmenty bits as well. But there are other sort of culture and values things which are really important too. Thanks.
John, I'm not sure whether you're watching the chat that's going on in the meeting, but Santosh has put a comment in saying, would it be possible to look at reducing agency locums? And Elizabeth has asked if it's possible to have AHP bank for more than 6 months. So I think if we just take those comments back to the recruitment team via Claire Teeney, that would be the ideal thing to do. And then Jordan has helped you out here, Julie. He's put up the diesel pump of recruiting now, just to show what those pump adverts look like. John, I have had another question come in, not on the meeting chat, via communications, which is probably a really, really, really important question for quite a few people that work on our sites. And the question is, and I'm not sure whether you're the right person to take it, John, is when are our cafes due to open across the trust?
That's a really important question, isn't it?
Absolutely.
I'm still having to make my sandwiches the night before and put them in the fridge and remember to take them in the morning. Joking aside, I don't know the answer to the question, and I suspect that it's going to be in the large amount of work that we're doing at the moment in terms of getting back to business as usual as we open up spaces. I don't know on the list where places like Cafe Art and what's the other one called? I can't remember what the other sandwich was.
Options, John.
Options. But having said that, miraculously, right of field, I know a woman who will know the answer, who's just put her hand up. So I'm going to, rather than continuing to waffle, Kay, over to you. Nice to see you. Oh dear, Kay, you sound like Mickey Mouse. I had trouble like that. It was my machine. If you log off and log back on, it will be like you're not on helium.
That was happening on the national news this morning, John. So if it can happen to Notts Healthcare, it can happen to them. It can happen to Notts Healthcare. They had to stop somebody talking about violence and things in schools because she sounded like a robot. So she had to log off and log back on again.
So we'll come back. We'll come back to that question when Kay's...
There are some comments, John, for you to pick up. In terms of, I think Jen must be on the call because she's responded to Santosh, just to say that we always prefer to employ our own colleagues as part of the Notts Healthcare team, but sometimes we do need to rely on agency locums for patient safety, and just asking for any ideas about how to attract colleagues, they'd be welcomed. And Kay is back in the room. Hi, Kay. If we could hand over to you now.
Hopefully I don't sound like a Disney character now.
Oh, you sound much better. More like your normal self, Kay.
That's okay. Thank you. So what I was going to say, John, was that there is a roadmap that's currently being worked through for the transition and phasing of our catering outlets back. Some of them are already working as a takeaway model currently, but with no seating availability. But what we're trying to do is make sure it's prioritised in line with the reform work that we're doing with the clinical divisions and the corporate services, so that we pull the services back in when there's footfall across the sites, etc. But it is over a 6-week period. So we're just putting that together, and then we can publicise that so that people can see it as exactly when it's going to happen and which areas are going to open up first. But it's all in hand.
Thank you.
Okay.
Thank you.
Thanks, Kay. Jen Guyver's obviously on the call. Jen, I don't know whether you want to say anything to the group, but you're obviously looking for ideas and things and asking for people to feed back to Charlotte Wyman as head of recruitment.
Hi, yeah, Jen's just nipped out, so that's perfect time.
Over to you, Charlotte.
Oh, she's back. She's back.
Saved by the bell.
I didn't hear the query though. Sorry, I was on my way to another meeting.
Just in terms of if we are wanting ideas of how to attract and recruit people, just to, you know, get in touch and contact us. Yeah, because we're always after any ideas that we can. But obviously we're developing our recruitment offer, like Julie said, and doing lots and lots of things. So, but any other ideas are very welcome.
Also, any contacts that people have. So the gentleman who wrote on the chat likely has got some really good contacts to do things slightly differently. That's what we need to do, because doing the same thing over and over again doesn't work.
Great, thanks, and sorry to put you both on the spot there, Charlotte and Jen. Much appreciated.
Well done, thank you.
Okay.
I think that's everything that I've got, John. So I don't know whether if there's no more questions coming through in the chat, I think it's probably over to you to sort of summarise and add any other context that you wish to add. Yeah,
thanks, Anne-Marie. I think it's interesting, isn't it? What Anne-Marie? Why did I call you Anne-Marie? Sorry. Well, Anne-Marie's got her hand up. Go on, Anne-Marie.
I was just going to add a couple of bits. If you wanted to say anything first, and
no, you do your bits, and then I'll finish off.
Okay. So I just wanted to let people know that on the back of John was saying that we have had a couple of inpatient deaths, and my thoughts and go out to everybody that's been involved. And I know this is a really difficult time. It was just to say that we have set up a learning forum now in the organisation. It started last week. It will run 6 times a year, and this really is an opportunity for us to learn across the organisation. One of the things that often external agencies talk to us about is about how do we learn across if an incident occurs and any of the learning that comes out from that, because most of you will be aware is that we do really in-depth, robust investigations into all incidents. And particularly anything like a death, we do a really comprehensive investigation, and often there's a lot of recommendations and learning that comes out from those. So it was just to say that as an organisation, we've set up a learning forum, which will run 6 times a year, representatives from the whole of the trust, and that is really for us to understand how we can learn across. We've also got an event occurring on the 22nd of June this year as well, around an incident that occurred last year, a death that occurred last year. And again, that's about how do we learn across and the key themes that are coming out from some of these investigations. And sometimes the coroner also gives us feedback as well about things that he would like or she would like us to start to investigate or look at or learn from. So it was just to let you know that really we've done some really good work around that. And the other thing I just wanted to mention as well is that I know that we've been talking to a lot of you around CQC and closed cultures. And actually, Alex Lyons has been doing a fantastic job at the just and restorative culture. That work is just about to be launched soon. But it was just to say that what we're doing is we're joining up all the dots together, and we're working really closely with Alex to look at how do we do the culture of care reviews. How do we do the just and restorative culture, and how do we look at the closed cultures? And we're bringing it all together into under one umbrella to make sure that there's some really good work that we can do across the whole organisation. A lot of you have already done self-assessments. You're telling me that you've done self-assessments for closed cultures. Some of you have devised the best, honestly, banners, leaflets, posters, and you're getting it out there, helping staff to understand, but also helping patients to understand what closed cultures looks like as well. So it was just to say a big thank you for really embracing this subject and really kind of like wanting to make a difference for our patients and our carers. So thank you very much for all of your input and the passion that you're showing around that. So it was just to say that. Thank you, John.
I'll get your name right this time. Thank you, Anne-Maria. So I'll start to finish off then, Yolanda, and there's a couple of things in the chat. So, but first, I just wanted to sort of follow on from Anne-Maria's comment there, just in terms of as we progress out of this wave of the pandemic, we will be keeping some of the MS Teams work, because it's a really efficient way of doing some things, isn't it? And I think short bursts of large numbers of people for high level messaging, those learning forums and other things. So and it may be that for us to sort of summarize that and collate it for people. So speaking to the converted, because you're on this call obviously, but I know large numbers look at the recording, but we will probably continue in a similar vein with this. So the exec Q&A, the connecting knots, which is much more of a sort of headline showcasing. It's got a Q&A component to it. We've got those learning forums that Anne-Marie has just referred to. We also need to think about what about those big sort of one-day events that we used to do at Trent Vineyard, which were 200-300 people in a room. And I think we're still some way off that as yet, but I personally think there is some value in those, but it's certainly not the sort of frequency that we were having them monthly previously. And so that's all work that we've got in train. The other one I think works really well, that has been up until now, called Get Ready CQC, and we're now changing to Quality Matters. So Anne-Maria is and her team are leading that, and I think you're getting almost up to 100 people on those calls, Anne-Maria. That all of these are open to everybody, and so it's not hierarchical. It's not related to your band. And if you're interested, you want to get involved, you want to make a difference, So tell your colleagues, tell your peers, tell your friends to, to dial in. And if you want to contribute. And then the last thing I wanted to pick up in the chat, which is something that Marie Smith put in around recruitment, which is, again, some work that I wasn't cited on with NHS England called Next Gen Nurses. And Marie, you put, I know this is way down the line, but that's the thing, it isn't, is it? This is really, really important work. There's been a national shortage of professionally qualified nursing staff for some time now, and with the demands that are placed upon us, it's going to be so important, isn't it? And I think we need to think as an organisation how we can continue to support that. And what you've described there in terms of getting young people, particularly from ethnic minority backgrounds and men, it is a brilliant endeavour. And that's something we'll take away and just explore a bit more, because they're the sorts of things I think will stand us in good stead in the longer term. And I think I can't talk and read the chat at the same time, Yolanda, so I don't know if anything else has come in since then, but otherwise that's me done. Thank you.
I'm on mute. There's a few private chats going on, John, on the group between Marie and various other people. And so thank you. I've actually put a thank you in because everybody's been quite active today on the chat, which is really good to see. So I've actually said thank you to those that have got involved. Anne-Marie has just mentioned about the Quality Matters session, which takes place every month. And to check out to check out, connect or speak to Sharon Rosenfeld for that. And the CQC section, all the events are on there. So I think that's a really great way to end the session, John, and all of the execs, and for everybody that's been participating today. Thank you very much.
Thanks, everybody. Have a good afternoon.